let's discuss the acute emergency in case you're having an acute problem right now and your back is out. What to do? You should lay down on the floor. Actually, before you lay down on the floor, get an ice pack if you have by any chance in your refrigerator a gel pack that's cold. Use that, and if you don't have that, put some ice cubes in a plastic bag and tie a knot, and then cover that with a little towel. Now lay down on the floor, and you want to have a large pillow under your knees and a small flat pillow under your head. You're not using the ice quite yet. If you have a very small ice bag or the refreezable gel pack, you might be able to slide that under the small of your back. If you don't have that gel pack and you just have the bag of ice, then every 20 minutes while you're lying on the floor, turn over on your side slowly, trying to keep your knees slightly bent so that you're comfortable, fetal position, and put the ice bag on and just hold it in place for about 15 minutes, then remove it. Go back to your lying back on the flat of your back, knees elevated on the large pillow, head supported by a small flat pillow, and just alternate between the lying on the back and the ice. The other thing that you can take for your pain, the acute pain, is Advil, which you can take as 200 milligrams, and you can take that every 4 hours. It should be taken, if possible, with food, even if it's just a small amount of food, so that you don't get a stomach upset. And you want to take that every 4 hours for 24 hours, and that should also help with your acute pain. Do not use heat under any circumstances. The acute situation must be treated with ice, with cold. And the other thing you should do is call your chiropractor or your MD on your cell phone, let them know what happened, and try to set up an appointment at the earliest possible convenience where they have time to see you, and usually they can for an emergency, particular chiropractors, and try to get to see the chiropractor the following day. So that's what you want to do for an emergency. It's the ice, it's the medication, the Advil. You could also, if you're able to get it, use extra strength Motrin, Motrin 800. If you get a prescription for Motrin 800, that's very strong, and that you could take once every 10 hours, every 12 hours, but that has to be taken also with food. So these are the things to do for the acute emergency while you slowly get back into back rest, resting on the floor, doing whatever you have to do several days till you're feeling more normal. Then you can begin the exercises that we are going to teach you.